Hello everyone, my name is Jessica Mangano, and today I will be talking to you about obsessive compulsive disorder in accordance to the Diagnostic Statistical Manual of Mental Disorders 5, also known as DSM-5. Before we dive into the facts about OCD, I want to introduce you to a student of mine named Andrew. Andrew is currently in the 3rd grade and is full of life and energy. He enjoys playing soccer, reading, and going to the park with anyone who will join him. He lives with his twin brother, older sister, mother, and father in New York City. His father is a lawyer who loves to kick a ball around with Andrew, and his mother is an interior designer who looks forward to reading to Andrew in bed each night. If you were to meet Andrew, you would never be able to guess that he is diagnosed with OCD, Obsessive Compulsive Disorder. So what is OCD? OCD affects people of all ages and causes those who it affects to have frequent fears, worries, urges, or thoughts. These are called obsessions. Obsessions distract or distress the people who have them. The obsessions are often combined with ritualistic behaviors, which we call compulsions. The compulsions are repeated in an intense attempt to deal with unwanted obsessions. Anxiety is a frequent symptom of OCD. However, obsessions and compulsions are unique features to this disorder. The following information is the DSM-5 criteria for being diagnosed with obsessive compulsion disorder. According to the DSM-5, in order to have OCD, you must have either obsessions or compulsions. You must realize that your obsessions and compulsions are excessive or unreasonable. Lastly, your obsessions and compulsions must significantly interfere with your daily routine. Let's talk more specifically about the obsessions someone must have. Your obsessions must be recurrent or persistent thoughts, impulses, or images that are intrusive and cause distress. The thoughts aren't simple excessive worries. You try to ignore or suppress these thoughts, images, or impulses, but struggle to do so. Finally, you know that these thoughts, images, and impulses are a product of your own mind. The last part of the DSM-5 criteria discusses compulsions. Your compulsions must meet these specific criteria. The first is that you feel driven to perform the repetitive behavior, and the second is that the compulsion is performed in an attempt to reduce distress about unrealistic obsessions. We will talk about specific examples of obsessions and compulsions in a little bit. OCD affects everyone differently. However, there are some common symptoms in children. Children may be excessively preoccupied with germs, dirt, or illness. The child may express repeated doubts. Another common symptom is the child may be experiencing intrusive thoughts about a parent getting hurt. Children who have OCD may become excessively preoccupied with symmetry, order, and exactness, and pay unreasonable attention to detail. Lastly, they have an excessive drive to know or remember facts that seem very trivial. Please take note that this does not mean every child with OCD must display these behaviors. The following symptoms are just a few examples of what OCD may look like in children. There are many facts and statistics on OCD, but I felt these were 3 of the most relevant. Approximately 2.3% of the population, ages 18 to 54, suffer from OCD. In the U.S., approximately 3.3 million people suffer from OCD. There are various estimates, and some have reached as high as 6 million. This variance comes from how patients are diagnosed and categorized. Lastly, OCD is more common in boys than in girls. You may be asking yourself, what is the difference between OCD obsessions and everyday obsessions? Everyone has obsessive thoughts at some point in their life. People may double-check a locked door, dislike a new facial wrinkle, save a few special items, pull out a gray hair, or pick at a blemish. This is normal behavior, and it is part of life from time to time. People resume their daily tasks without much further thought to these concerns. In contrast, people with OCD are held captive by their obsessions and compulsions. Their repeated behaviors and extreme concerns can take over their daily lives, cause health problems, and impair their social ties and schoolwork or functions. Many people with OCD know or suspect that their obsessions are likely not true. This knowledge is called insight. Others with OCD may think that their beliefs could be true. This is considered poor insight. Others are strongly convinced that their beliefs are in fact true. This is called absent insight. Despite the level of insight, people with OCD have a hard time keeping their focus off their strong obsessions and stopping their compulsions. The worry or stress caused by the obsessions, a thought, urge, or image that causes distress, leads to an attempt to ignore or suppress it by another thought or action. That other thought or action is called a compulsion. Common obsessions are the fear of getting sick from dirt or germs and harm to self or others. Compulsions are actions such as constant checking, such as locks on doors, frequent hand washing until skin is raw, and counting. Compulsions are usually done to prevent a feared event. Children with obsessive compulsive disorder may not be able to explain the purpose for their compulsions. An example of this is placing objects on a shelf in a certain order to prevent parents from being in a car accident. The thought and action do not make sense, but to the child with OCD it does. That is because people with OCD believe that the acts performed will counter the thought, urge, or fear. However, relief is only temporary. Although compulsions may bring some brief relief to the worry and stress of an obsession, the obsession returns and the cycle of obsessions and compulsions repeats again and again. To better understand common obsessive thoughts in OCD, I have created a list of a few of the most common behaviors seen. They are as follows: fear of something horrible happening to a loved one, profound worry that they will do something extremely embarrassing, a strong need to reorder things until they feel just right, asking questions such as, am I safe? Did I lock the door? In the corner, you see a little picture that shows writing utensils perfectly in order except for one. While this may not bother you, it would inflict stress on a person with OCD. Now that we have a better idea of what obsessive compulsive disorder is, let's revisit my student Andrew. Andrew's parents became very concerned when they noticed Andrew would not leave the house without checking that the house door was locked 7 times. It was always 7 times, never 6 and never 8. After taking note of this behavior, they also noticed that Andrew would avoid making direct hand contact with anything that he labeled as dirty. He refused to use bathrooms in public places, touching swing sets at parks, or even touching the door handle at most places outside of his home. As this behavior developed, so did his hand-washing ritual. Andrew began washing his hands incessantly. He would wash multiple times a day for extended periods of time. This compulsion became distracting, as he wouldn't be able to concentrate on anything else if he felt his hands were dirty. His hands became raw. Andrew's mind became like this list. Did I wash my hands? Repeat, 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 repeat. While at school, Andrew's teachers saw many obsessive and compulsive behaviors. Andrew refused to use any of the classroom materials, specifically the classroom pencils. Andrew was also unable to walk into the classroom without touching the door frame in 2 precise places. This caused Andrew to become increasingly anxious because he knew his peers were aware of his ritualistic behaviors. Since he is only in 3rd grade, his peers didn't understand why he was performing this ritual. Ultimately, Andrew felt embarrassed to enter the classroom and began having moments where he refused to enter. Other OCD behaviors seen were constant washing of the hands, especially when other classmates would sneeze or cough. Andrew is very aware of his compulsive behaviors and constantly seeks reassurance from teachers and adults that he can't get sick from others' germs. After monitoring Andrew, his teachers and parents met to discuss the consistency of the behaviors observed. Andrew's parents decided to seek medical advice. After meeting with a medical professional, Andrew was diagnosed with OCD and is currently going through exposure and response prevention therapy. This is a type of CBT. What is CBT? CBT stands for Cognitive Behavior Therapy and is an effective treatment for people with OCD. With CBT, a mental health care provider will teach the patient to fight the obsessions more effectively and to challenge the ritualistic behaviors. During treatment sessions, people may be exposed to the obsessions that create anxiety and provoke the compulsions. They may write a script in which the obsessions are described, and then they read the script over and over. For Andrew, this technique is being used to tackle his hand-washing OCD. During treatment sessions, Andrew touches objects that he classifies as dirty. For example, he will touch a door handle. Once he touches the dirty object, he is not allowed to wash his hands. This exposure and response prevention therapy has been proven useful. CBT works well for people whose compulsions cause great problems. However, with very anxious people, the healthcare provider may begin with simpler tasks such as thinking of touching a doorknob and then not washing hands. Treatment only works if they adhere to the treatment methods. Some people may not agree to take part in CBT because of the anxiety it involves, and others have depression that must be treated at the same time. About 1 in 4 people are not able to cope with CBT. For those, medicine may be used. We will now discuss what OCD looks like in the classroom and how we as teachers can help. How do students who have OCD feel? They most commonly feel embarrassed, anxious, stressed, ashamed, defensive, and out of control. What does OCD look like in the classroom? Well, the student may appear to be daydreaming, distracted, disinterested, and lazy. They may seem unfocused and unable to concentrate, but they are really very busy focusing on their nagging urges or confusing, stressful, and sometimes terrifying OCD thoughts and images. While these behaviors are frustrating to educators, OCD may be torture for the students who have it. As teachers, it is important to understand who your students are and know that different people experience different obsessions and compulsions. It is best to meet with parents to better understand individual needs to create the most safe environment possible. Students with OCD struggle with stress, so it is important to keep a calm environment. Depending on the severity level, you may want to maintain flexibility on due dates and completion of schoolwork. The key is to be creative, flexible, kind, and have patience to successfully teach students with OCD. Obsessive-compulsive disorder is like an unwelcomed guest with bad manners. It moves into a mind and it doesn't want to leave. Now that you are highly informed about OCD, it is important to keep these facts in mind while teaching. We teachers have the power to create positive learning experiences for all students regardless of their so-called label. Embrace each student for who they are so that a positive example is set for the whole class. Do not let a label define a person. The following are 2 video links that address what obsessive-compulsive disorder is and examples of various treatment options for children with OCD.